morning, everybody. How are you? Are you awake yet after all of that good information? Anyway, if you'll just bear with me for a few minutes. I'm the Anabolic Labs rep. I'm Bob Rosenberg. We've been supporting you guys for quite a while now and happy to do so. But today I'd like to concentrate, if I could, on our 3 key pain and inflammation management supplements. I gave you all a basic handout, but back at my table there we have more information on the actual research and some case histories and other things to help you more effectively use these products with your patients. How many of you happen to have gotten to the ANJC convention on that wonderful, witchy, snowy day? I see some hands. Well, I was lucky enough, not only did I have to work the ANJC convention that day, but up the road in Newark was an activator seminar. And my good buddy, David Seaman, and most of you know David Seaman, he was teaching an hour on neurology and an hour on pain and inflammation management, nutritional support. And anytime David's speaking, and I'm close enough to get to him, I want to hear what he says, because whether he's speaking for an hour on nutrition or an entire weekend, I'm always going to pick up 2 or 3 things that I didn't know before. And David was really good about this. His first question when he was talking about our white willow bark product, Salazane, was, how many of you are familiar with white willow bark? Can I see your hands? And a lot of hands went up. How many of you think white willow bark is natural aspirin? Again, kind of a trick question. Most of the hands went up, and David said wrong. White willow bark is not natural aspirin, although a lot of people think it is. There's 1,000 milligrams of white willow bark in a tablet of our Salazane. Only 240 milligrams of that 1,000 milligrams is salicin. That salicin converts to about 100 milligrams of salicylic acid. So you're talking about a baby aspirin's worth of aspirin in a tablet of 1,000 milligrams of white willow bark. Maybe good for cardiovascular prevention, cardioprotective, but how does that help with pain and inflammation? That's not a normal therapeutic dose that you would take to help manage pain. So what David said is it's that other 700 milligrams of stuff in the white willow bark that gives it its properties. It's the tannins, it's the flavanols, it's the polyphenols, it's all those different biochemicals synergistically with that little baby aspirin's worth of salicylic acid that gives white willow bark the ability to reduce pain and inflammation. And so David said for patients that present with pain without obvious provoking injury or acute exacerbation of a chronic condition, that's where white willow bark is going to give you the most bang for the buck. And the reason we went with 240 milligrams in a tablet of the salicin is because that is what they used versus Vioxx in a study when they went head-to-head, 12.5 milligrams of Vioxx, 240 milligrams of salicin with idiopathic low back pain patients. You had comparable levels of low back pain reduction in both groups. The American Pain Society and the American College of Physicians placed white willow bark in the moderate category, which is the same as your opiates, your muscle relaxers, your antidepressants, your traditional NSAIDs, and your analgesics like Tylenol. So they're all in the moderate category. Nothing hits the bullseye dead on, and if it did, you just say, hey, take the magic red pill, and life is good. It doesn't work that way. It needs the manual care that you guys do, along with reducing anti-inflammatory diet. Certainly get more vegetation and animals that eat vegetation into the diet, along with things like the Salazane that help downregulate the expression of inflammation. Back there, I left a pretty neat paper by Nikolai Bogduk. Is Bogduk a familiar name to, obviously, the doctor with many initials after her name recognizes the name Bogduk, and I'd be surprised if Dr. Foss didn't. But Nikolai Bogduk is a world-renowned expert when it comes to treating pain. He's got many papers on pain. He's got books on low back pain, books on neck pain, and I included the front page of the study up at my table there, and it's pharmacological alternatives for the alleviation of back pain. And in that paper, and let me just read it to you because this is kind of cool. He says drugs constitute a convenient option for low back pain commonly used Evidence for efficacy is meager. Many drugs used for back pain no more, only slightly more effective than placebos. Others, the side effects outweigh usefulness in relieving pain. On the basis of evidence, no drug regimen can legitimately be recommended for back pain. Management of back pain requires measures other than drugs. One exception is the use of willow bark for acute exacerbation of pain. And then he says, ironically, for chronic low back pain, and his definition of chronic is greater than 3 months, he just says simple saline injection into the tender points of the lumbar spine is as effective as any meds that they inject in there. How powerful is that for what you guys do versus this going and taking the meds? So anyway, Salazane for pain without obvious provoking injury. The other one on here is Zymane, and that's for pain with obvious provoking injuries, your strain, sprain, whiplash type injuries. And then the third one is your Proens, and that's your blend of spices, your chronic aches and pains, your wear and tear of daily living. And it's just a nice blend of spices to help downregulate the overexpression of chronic inflammation. And on the back here is kind of a little cheat chart which you can follow. But on the front is a link to our website, and there are 3 5-minute video segments with Russ Antico, and he's a sports chiropractor like yourselves, and David Seaman, and they spend about 5 minutes discussing clinical application of the 3 different products. And if you're not comfortable recommending these things to your patients, after viewing the videos, I think you'll be a lot more comfortable, so I'd encourage you to visit the website and take a look at that. And for those of you who want to get more involved with the supplements, we do have a basic starter kit. You can get 1 free with the purchase of 4 of those things, the Zymane, the Proens, and the Salazane. Come see me and come grab some information, and thank you for indulging me for a moment.